Good morning. My intention for the day I've been sharing with y'all and had really good feedback on. Today my intention is to really focus on my craft, and for me that is my gift and it is in my job. That might not be the case for you right now in your life, but maybe it is. If you are not liking your job, my recommendation is to ask yourself how you can dig in, how you can do a better job, because the job is a neutral circumstance. You're probably doing it so that you can put food on your table, maybe have a car, maybe have enough blankets in the winter to stay warm. So go ahead and just let yourself give more in your job. It's not for your job, it's not for your employer. You do this for you. You will feel better. There's good science behind it. So today I have a patient who has never had osteopathic manipulation before, and I'm a doctor of osteopathy. I love doing osteopathic manipulation. If you've been in the clinic, you know that we have these vintage, beautifully restored 1930s osteopathic tables from the motherland of Missouri, motherland of osteopathy. So she's coming in and she was asking about lymphatic treatments because there's a new lymphatic business here in Austin, a place where you can go and get your lymphatics pumped. And so in preparation, I woke up all excited because it's her first time. And I thought, hey, I'll just pull out my anatomy book from Gross Anatomy in medical school and show her. In these photos, you can see the lymphatics are detailed in yellow. And in case you're curious about the lymphatics, look how cool this is. So the renderings here, the blue represent the veins, and veins bring blood and other fluids back to the heart. Arteries, which are generally depicted in red, bring blood and fluids away from the heart. So remember that the heart is the main pump in the body, and it's super fun to think about the heart because it's a muscle. It pumps. We all know the heart pumps, right? But how does it pump? Or as my dad, he would joke around and say, how do it pump? He was a surgeon, but he was from Arkansas. He just couldn't help but slip back sometimes to that lingo. Well, the heart has its own electrical system. That's right, its own electricity, and that electricity pumps the heart to pump the fluids through out the body, through the arteries, away from the heart, and the veins bring it back in. But then these lymphatics, oh my gosh, how does that fit in? Well, the lymphatics drain fluid in a whole other system that is not completely separate from the veins and the arteries. They do communicate, but look here at these little bulbs. Okay, so this is the head and neck, but we have lymphatics throughout our entire system. Here are the lymphatics in green in the intra-abdominal area. So throughout the entire body, you have these lymphatic systems, and I'm even going to show you how they are depicted in the lower limb. Okay, so when you come in, the most dramatic example I can give you is a pregnant patient. Okay, so when a woman is pregnant, she's got that fetus right in here, and that impedes fluids from their normal path back up to the heart. And that's why pregnant women very often, okay, always at some point, are going to have swelling in the lower extremity. They complain about their feet being swollen, but in fact, when we get our hands on them, the swelling is from the tips of their toes all the way up to where that fetus is growing, where they haven't had that girth before. It's that impediment. So I lay them down on the table, supine position, that's face up. Lay them down or lie them down. Oh, if Richard Queen was here, he would correct me. We would lie, I think they lie down. I would lay her on the table, or she would lie on the table. Lie, okay. So she's down there, and then I get my hands on her feet and do these venous and lymphatic pumps, they're called. So I pump the fluid. It's a very gentle rocking motion. It doesn't hurt at all. It's not a high velocity, low amplitude move like popping the neck or popping the back. It feels wonderful, and very often people will have the desire to spit or blow their nose because Once you get those lymphatics moving, the fluids just really start shifting for you. So if you're having any swelling, if you're having swelling anywhere that's unusual, let's say in an extremity like your arm or your face or your legs, you don't need to be pregnant. You can even be a dude and not be pregnant and have some swelling somewhere. Come on in, see your local osteopath, and let us figure out what's going on, number one, with your fluids. And if it's a simple, hey, let's encourage your lymphatics to move, then we have some great maneuvers that we can do for the entire system. Sometimes it's in the face, the head, and the neck. And so I showed you those pictures earlier. I can get in there and do some gentle maneuvers to push on those little nodes, those little round yellow parts of the lymphatics, and get things moving. If you're sick, if you have any kind of congestion in your head and neck, the lymphatics to address, and you can try this at home. There's no reason not to. It's fun. You might get it right. If you get it wrong, it's still gonna probably feel good. So the lymphatics up in here really drain the whole head and neck. With the lymphatics, it's not a hard, if you press too hard, you're just gonna blow beyond the lymphatics and you're gonna be in the muscles. So just do some light tapping if you feel congested in these lymphatics here, and they go all the way up your head and neck, so you can tap here. And when I do that at some point, like I just did, feel the need to swallow, and then you know you're getting those fluids to move around. When we walk, just walking, just moving the body does stimulate the lymphatics, so that's a good little exercise to do there. And handstands are great for the lymphatics because it gets them moving in the other direction, right, using gravity. So that's what I have for you today. You can see that at my age, and yes, children, I've been a doctor literally since the last century, I'm still very excited about my work. And if you're not excited about your work, figure out how you can get excited about your work. Don't expect your job to do it for you. Don't expect your boss to do it for you, all right? It's up to you. Find something that you really enjoy. And maybe it's not your work, and maybe you're just hanging on until 5 p.m. so you get home and mess with your plants or whatever your hobby is. But I would encourage you to show up a little bit more, a little bit of a better you, whether your craft is at your job or your career or at home or outside of work. Why? Because you'll feel better. And isn't that why we do anything ever in the world, is to feel better? Sure is.